How should we think about ownership in such a distributed setup, and what reality, makes medtech supply chains different?
So MedTech is not globalized for cost. It is actually structurally fragmented by the capability specialization. As we see on the map, there is no single geography that has end-to-end control. Yes, there are certain domains where the 60 to 70% of the money lies. But yes, in terms of the value chain, it is highly dependent and fragile on various parts of the world. As we see on the West, the North America controls the intelligence layer, where the major companies like Medtronic, Johnson and Johnson, Baxter resides. They design the softwares, they design the systems, and they have a high switching power. Europe, which controls the precision and compliance, and they regulate the quality bottleneck authority. Japan, which offers an invisible dominance in the entire supply chain. They develop the high-end components and low substitutability product, and they have the hidden concentration. When it comes to China, say 10 to 15 years before, the China was tier 2, tier 3 supplier in the medtech supply chain. But over the years, they have built themselves from volume to control. And the high-end medical devices, such as imaging systems, such as robotic surgeries, and so on, are being built in China. So they just don't scale for the volume supply chain, but they also scale for the high-end products in the supply chain. Africa, of course, they are underestimated, but there are a lot of dependency on them for the critical minerals, especially where the electronic components are being needed. In India and South Asia, they offer a cost arbitrage zones, but not yet the control centers. So the net insight is that the medtech supply chain is not only diversified, it's geographically specialized and tightly coupled.